Rest, a rigid extension of a removable partial denture that contacts the occlusal, incisal, cingulum, or lingual surface of a tooth or restoration, the surface of which is commonly prepared to receive it. Rest seat, the prepared recess in a tooth or restoration developed to receive the occlusal, incisal, cingulum, or lingual rest. A rest that is part of a retentive clasp assembly is referred to as a primary rest. A rest that is responsible for additional support or indirect retention is called an auxiliary rest or secondary rest. Primary rests prevent vertical movement of a prosthesis toward the tissues and also help transmit applied forces to the supporting teeth. Auxiliary or secondary rests are used as indirect retainers in extension-based removable partial dentures. Occlusal rests, so named because they are seated on the occlusal surfaces of posterior teeth. 2. Lingual or cingulum rests, those seated on the lingual surfaces of anterior teeth, usually maxillary canines. 3. Incisal rests, those seated on the incisal edges of anterior teeth. Importance of rest and rest seat. Forces that are applied to a removable partial denture must be transferred to the supporting teeth and tissues in an atraumatic fashion. In addition to transferring forces, each rest should serve as a vertical stop for the prosthesis. Firm, positive contact between a rest and rest seat minimizes vertical displacement of the prosthesis and prevents injury to the soft tissues. A rest also must maintain the retentive clasp in its proper position. Occlusal rest. 1. The outline form of an occlusal rest seat should be a rounded triangular shape with the apex toward the center of the occlusal surface. 2. It should be as long as it is wide, and the base of the triangular shape, at the marginal ridge, should be at least 2.5 mm for both molars and premolars. 3. A reduction of the marginal ridge of approximately 1.5 mm is usually necessary. 4. The flow of the occlusal rest seat should be apical to the marginal ridge in the occlusal surface and should be concave, or spoon-shaped, preparing a rest seat to avoid creating sharp edges or line angles in the preparation. 5. The angle formed by the occlusal rest in the vertical minor connector from which it originates should be less than 90 degrees. Only in this way can the occlusal forces be directed along the long axis of the abutment tooth. Lingual or cingulum rests and rest seats. Lingual or cingulum rests are used primarily on maxillary canines. The normal morphology of a maxillary canine permits preparation of a satisfactory rest seat with minimal tooth reduction. However, a lingual rest is preferred to an incisal rest. A lingual rest is located closer to the rotational center of the supporting tooth and does not tend to tip the tooth. 1. A lingual rest is preferable to an incisal rest because it is placed closer to the horizontal axis of rotation, tipping axis, of the abutment and therefore will have less of a tendency to tip the tooth. In addition, lingual rests are more aesthetically acceptable than are incisal rests. 2. A slightly rounded V is prepared on the lingual surface at the junction of the gingival and the middle one-third of the tooth. 3. Sharp line angles and corners must be avoided because they complicate the fit of the cast framework and may serve as stress concentrators. Incisal rests. Incisal rests are placed at the incisal angles of anterior teeth and on prepared rest seats. Although this is the least desirable placement of a rest seat, incisal rests are used predominantly as auxiliary rests or as indirect retainer. Although the incisal rest may be used on a canine abutment in either arch, it is more applicable to the mandibular canine. An incisal rest seat is prepared in the form of a rounded notch at the incisal angle of a canine or on the incisal edge. The notch should be beveled both labially and lingually, and the lingual enamel should be partly shaped to accommodate the rigid minor connector connecting the rest to the framework. An incisal rest seat should be approximately 2.5 mm wide and 1.5 mm deep so that the rest will be strong without having to exceed the natural contour of the incisal edge.